In the United States, more than 1.3 million people are injured by medication errors every year. About 400,000 of these happen in hospitals. In fact, 1 in 5 medication doses in U.S. hospitals are given in error, leading to 7,000 to 9,000 deaths per year. Factors contributing to these staggering numbers include insufficient staffing of nurses, increasingly longer shift requirements, both the number of patients per nurse and the intensity of care required per patient, a nurse's individual experience and ability, and the workplace safety climate. Importantly, these factors fluctuate in real time and from day to day. Dr. Amy Campbell's team at USA recognized this need and created a software tool that can monitor factors affecting a nurse's workload and environment. This tool helps reduce medication errors without adding additional workload on the nurse. For Dr. Campbell, the first step was to convert medication errors, defined as preventable by the Food and Drug Administration, into near misses, defined as medication errors that were actually prevented prior to causing patient harm. The second step was to identify a way to predict near misses and stop those too. In other words, recognizing symptoms in order to prevent a problem from occurring. Today, barcode scanning prior to administering a medication is the best and last line of defense in catching medication errors. Dr. Campbell recognized that while barcode scanner and computer order systems have had a positive impact on reducing errors, the major challenge was in finding a true way to monitor or enforce things like critical thinking and workload management, intangibles that are essential for avoiding medication errors. Dr. Campbell used her own knowledge and expertise as a nurse and in nurse informatics to develop the Nurse's Dashboard, a unique software application that uses a combination of historical data and current hospital information to calculate in real time a nurse's personalized risk profile for the likelihood of medication errors using distinct factors confirmed as widely influential in medication near misses. These factors are hours worked in the previous week, nurse's work schedule, patient count, or total number of patients the nurse is assigned during a shift, patient acuity, or the intensity of care provided to a patient by a nurse, call light count, or how many times a nurse has to respond to a patient's call light being activated, medication count, or how many medications the nurse must administer, task count, any other tasks the nurse is responsible for during a shift. Each nurse develops a personalized profile based on their individual historical data in each of these distinct areas. During a shift, the Nurse's Dashboard processes data from the same factors in real time to compare with the historical risk profile data. The result is a single, easy-to-read screen consisting of stoplight displays for each nurse, providing a green, yellow, or red signal that indicates the personalized level of risk of any individual nurse for making a medication error. This allows the nurse to be more self-aware and serves as an aid in proactively seeking workload assistance. The Nurse's Dashboard can also function to alert coworkers that a nurse may temporarily need assistance with workload without the nurse needing to seek out fellow staff and ask for help, which can enhance the unit's sense of teamwork. The dashboard may also be expanded as a data guide for hospital administrators to identify patterns in performance and areas to broaden and enhance risk management practices. The Nurse's Dashboard is positioned for significant economic and societal impact. Economically, the Nursing Dashboard can reduce the more than $40 billion the U.S. spends each year on patients who have been affected by medication errors. The global cost of medication errors is almost 1% of the $8 trillion global health expenditure. More importantly, preventing medication errors will reduce the incidence of related birth defects, disabilities, hospitalizations, and deaths, increasing overall patient trust in the healthcare system.